This is CBS 5 News, telling it like it is.
And could that mall shooting in Oregon have contributed to today's shooting? Earlier this evening, I sat down with Scottsdale psychiatrist Dr. Michael Yasinski. He says learning about the tragedy in Portland may have given today's shooter some sort of confidence boost.
Sometimes people are thinking about doing something but really won't act on it until they see someone else that maybe achieves it and does it, and then they get the idea that, well, look at the notoriety they got, you know, I want to get revenge, I want to be known and seen, and, you know, who knows, that could be something that pushes people over the edge.
It's one thing for somebody who's mentally off or disturbed to want to take their own life, but a classroom full of 5-year-olds, who do that?
You know, that's where you question. There's, you know, you really do want to look at, is there a severe mental illness going on where, you know, this is the age a young male typically is when you get first break psychotic symptoms, where you lose touch with reality or get very severe symptoms, because this just is not normal, and even people with psychological trauma from childhood rarely act out on this level. So it's often a combination of psychological trauma and an underlying really severe mental illness that combines to give you this outcome.
Is there some kind of sense of grandiosity or power that comes into play? They're in control of this world where they have just wiped out so many innocent people?
Sure. I think a big theme in people that have never had control in their lives, often a traumatic past where, you know, they had little control to take care of their lives, and this is a way to actually regain control. Some aspect of their life can, in their head, is making up for all the years of lack of control, only obviously it's not a rational way of thinking.
A lot of things were in play there that should have been the way that they were. What could have prevented this? Could somebody have spotted? Were there some kind of signs?
Yeah, I think there's a running theme of signs tend to be someone this age that tends to start isolating themselves, for example, or, you know, using drugs or alcohol in excess and isolating themselves. But I think it's really hard to ever predict who will do this kind of thing. I think we try and keep finding ways to predict who will do this and kind of see what types of people fit the category, but I think really you have to look at getting people to want treatment and really attacking the stigma side of things, so people will actually want to go get help themselves rather than us trying to kind of impose help on people.
Those 5-year-old faces and those teachers, they don't see them as people.
Right.
To be able to shoot them and kill them in the way that he did and by the sheer numbers.
Yeah, I do think actually society plays a role in, you know, how we've created games and violence that take the human aspect out of violence, and I'm afraid that some people actually can carry that over into reality and really detach from the fact that these are human lives.